We have a special advisory committee, and we've been reviewing evidence from around the world around when people are able to transmit this virus. So we did come up, it's not a recommendation. It is a permissive use, if you will, and for exactly the reasons that you say. This virus can't jump 6 feet. So when you're outside, maintaining physical distance are things we know works, and we've seen that here in BC. So there are proven things we know that prevent transmission of this virus. Cleaning your hands regularly, covering your mouth when you cough, not touching your face and eyes, and maintaining that safe distance from people. Wear a non-medical mask, and I can't emphasize that enough, and we've talked about that here. Medical masks and respirators need to be reserved for our healthcare settings and our healthcare workers, because that's where they do the most good. But a handmade cloth face covering that we've seen people using in other places, for short term, they can protect others around you from your droplets. So it's not going to protect you from getting infected with this virus. But for short term, it is a similar analogy to coughing into your sleeve or coughing into a tissue. It may keep your droplets in so that they're not in the air or in the on surfaces around you. It's not an alternative to the things that we know work, but in those places where you might not be able to maintain the physical distance for the whole time, like transportation, for example, or if you have to go out to the grocery store, it is an option for people. I think we need to be very careful not to say that it's required or recommended for everybody, but it is an option, particularly if you're not sure that you're going to be able to cover your cough if you need to.
And yes, I think we've made progress working with the federal government, and in the work that we're doing has involved everyone, the leadership of the Premier, the leadership by the whole government, at the Deputy Minister level, by Dr. Henry and everyone else. So I think we're making progress, and I think they're hearing us, and we're going to work with them to see that change happens. Because remember, it's a variety of sources. There's people coming home via the land borders, and that's important. And every single one of them has to have a plan to self-isolate for 14 days, every one. There's people coming in at YVR, both from international flights, and I think I checked Friday, I think there are 9 or so flights from Seattle, from San Francisco, from Los Angeles, including flights that go to Kelowna and Victoria. So all of that requires everybody to have a plan, and for us, one, to be able to support people in that, should they require such support. But everyone has to self-isolate for 14 days. That's the rule under the Quarantine Act, and it's not just the letter of the law. The letter of the law has to be felt in practice. So I think the federal government has heard us on that, and we're working with them, and I'm hopeful that we're going to be able to let everyone know about that progress very soon.